In this next video, I'm going to explain a little more detail about the second page of the bill. So the top section I covered in the overview. These are the information management fees. So the spirit of this is that for the common lab and x-ray bundles or chronic prescriptions, that you get paid in advance for reviewing the labs and dealing with them, basically on the labs, and on the chronic prescriptions, just the prior auths and people changing pharmacies and that sort of thing. So the spirit of this is, let's take the labs. Let's say the labs all come back normal, call, text, whatever you feel is appropriate. Patient say, lab's fine, keep taking your pills, that sort of thing. I think most of the time you won't need to spend a lot of time with this, and you're not going to get rich off these. It's $3 a pop, and it's just a little bit extra to respect the time and mental thought it takes to make good medical decisions based on the results of the labs and x-rays. On the other hand, if let's say you got a metabolic panel and the potassium was 2.8, and however you want to manage that, call in a prescription, tell a patient eat more bananas, whatever you think the right answer is, then no fair than charging them for that phone call. They are essentially prepaying you for that sort of a thing. This middle section is for the advanced imaging, so CAT scans, MRIs, that sort of a thing, where there's often so much information in the impression, those aren't going to go quickly. Mammograms are in there because over a 10-year period, if women have 5 mammograms, about half of them will have an abnormality. Of course, they're scared to death. You have to really explain the meaning of it. And so these are $10 a piece because they are going to take you a little more time and effort to deal with. The next section is common other fees. So for like a well child visit, there's sort of that add-on fee. They're just going to take will pay you for the time to ask whatever routine questions you think should be asked. Later on, the vaccination fees and that sort of stuff is built into this. The next one is, I call it annual conversation. I know there will be patients that say, hey, I'm here for my annual physical. Cochrane reviews and other sources, of course, say the annual physical is really a worthless thing. And so I just like to reframe it to an annual conversation if the patient asks for it. That you talk about whatever concerns they have, educate them about some basic, health issues, that sort of a thing. And then, if they still want you to examine them, then this fee helps cover that. If you need to do a pelvic exam, like for a pap smear, then that does take a lot of time and effort, so there's a fee for that. Here's the vaccination fees. They're sort of set to be on the lowish end of what I think the market tends to bear. Venipuncture, prolonged counseling. This is for if you have somebody that has mental health issues or whatever. It's a place where you can document that. And then there's another place you can do it. I'll show you in another video. And then these common written screening tools are for things like the PHQ-9 or the anxiety score, or the brief ones. And then if it's a longer one like a MoCA or Tenetti Gait and Balance or whatever, this isn't paying you really for the total time it takes for the patient to fill this out. It's just paying you for the time to sort of add up the score and then discuss with the patient the ramifications of the results. And then finally, there's office performed tests. These are also set at rates that I think are kind of the low end of what people typically charge. And the spirit of this is I want you to get paid for having good long conversations with patients and thinking about their needs, not ordering a bunch of tests. But of course, there is a cost to doing these things, and so you should be paid for that.